For almost 50 years, emergency medicine residents at UCSF Fresno have been training first responders by organizing and leading a mass casualty incident drill in an austere environment like the Kings Canyon and Sequoia National Park. In mass casualty incidents, events that overwhelm or exceed emergency medical resources in harsh or remote wilderness environments such as national parks, park rangers, law enforcement, and firefighters are the first to respond. These emergency medical service providers must be prepared to provide expert emergency life-saving care. The drill teaches how to respond in case of a large incident with multiple patients and a wide range of injuries, including fatalities.
The goal is to have them practice this because the process of triaging and treating multiple patients and then extricating and transporting those patients needs to be practiced because it happens rarely, and it's the disaster response that they need to learn.
This year, 2 second-year emergency medicine residents organized the drill with the help of park medic faculty.
I think this is honestly the best parts of our program, and one of the main things that brought me here is being able to come out here and work with the rangers in the national parks, specifically for patient care and helping them to improve their patient care. Unfortunately, these are things that can happen in our national parks, and having a role in training the rangers to better respond to these incidents is just a really, really cool experience.
In May, the UCSF Fresno drill instructors headed to the Sequoia and Kings Canyon National Park to execute the drill. Training day began with a lecture and hands-on skills practice. Volunteers were prepared with fake wounds and learned the patient role they'd play in each incident. Once ready and in place, first responders and park rangers worked to rescue injured campers after a simulated tree fall in a campground caused by extreme weather conditions. The second simulated scenario was a vehicle crash with 16 victims, including fatalities.
They are the ones providing that first medical response in the most austere environments in our country. And we have the incredible privilege here at this residency program to train each and every one of them.
She and Dr. Mueller are both from Iowa and chose to do their residency at UCSF Fresno because of the opportunities they saw in the training program. They were excited about the exposure to wilderness medicine and the emergency medicine residency's strong emphasis on clinical teaching and hands-on training.
There's just a lot of support among my co-residents that I find it's an awesome learning environment and an awesome place to provide patient care.
By organizing the training, emergency medicine residents not only learn how to teach EMS providers how to provide care after a disaster, but also learn to coordinate a drill to train future emergency room doctors with EMS systems. I'm Lucero Benitez with UCSF Fresno Up Close.